everyone. My name is Brandon Robichaux, and today we're going to talk about the Chancroid disease. Chancroid disease is caused by a bacteria called Haemophilus ducreyi, which enters the skin during sexual intercourse. It can be transmitted through a couple different ways: vaginal sex, oral sex, anal sex, or through skin-to-skin contact with an infected sore. Some symptoms for the men include small red bumps on genitals. The bumps may become open within a few days, or the ulcer can form anywhere on the genitals, the scrotum, the penis, etc. A few of the symptoms for the women: 4 or more red bumps on the labia, between labia and anus, or on the thighs. It can develop anywhere. Once the bumps open, women may experience a burning sensation during urination and or bowel movements. Now, a few symptoms for both genders: the size of the ulcers can go anywhere from 1/8 of an inch to about 2 inches. The ulcers, they usually have a soft center and they're gray in color. Possible pain during intercourse, swelling in the groin area, swollen lymph nodes, and ulcers may bleed easily if touched. Now, a couple ways to treat the Chancroid disease. It can be treated with medication. It may go away in several weeks, depending on if you let it sit by itself. Antibiotics can help decrease the chance of scarring when the ulcers go away. And the doctor may also call for surgery to drain the large abscess in the lymph nodes, which may be sore. A few ways to prevent getting the Chancroid disease is to use condoms during intercourse. You should limit the amount of sexual partners that you may have. Avoid high-risk activities that lead to STIs. And you always want to alert all partners if you should develop this disease. Now, a few statistics. From the years 1985 to 2012, the number of reported cases of Chancroid disease in the United States have decreased and fluctuated from about 5,000 cases to 1,000 cases. It's actually below 1,000. In 2010, a total of 24 cases were reported within the United States, with only 9 states reporting that they have had only 1 or more cases of Chancroid disease. As recently, the disease is very rare in the United States. It's usually caused in the United States if someone has previously been to another country and then transferred it back over here. Some additional information to remember about the Chancroid disease is that people who are unsure of what Chancroid disease is, because it's so uncommon in the United States, it's more common in men than women. Early signs may be mistaken for syphilis until the ulcers start to develop and you see how much bigger they get. Should one partner become affected, all remaining partners should get tested at about the same time, and a person that can be reinfected after the treatment. That's it for Chancroid disease. Thanks for viewing this announcement.